Hello, Kay, it's great. My name is Kate Bancroft. I'm one of the course leaders at Carnegie School of Education. I'm just going to speak to you for about 10 minutes really about some of the issues with using a quantitative approach to data collection. I've not done tons and tons of slides because I just wanted to give you more of a practical discussion and an overview about it. But as you can see, from the booklet that Kay has shared with you and given you some time to read. So we're going to go through that in a minute, and I'm going to talk about some problems with it and ways in which me and some Leeds Beckett colleagues have tried to overcome some of the issues that came about as a result of that particular topic. So first of all, just this picture sums it up quite well. The way I feel is hard to quantify, and then there's a woman saying, on how hard of a scale of 1 to 10 is it to quantify? So as I'm sure you already know by now, there are two different types of research approaches. So quantitative, which tends to be about statistics, and qualitative, which is more about insights. Both of them have got different advantages and disadvantages, which I'm sure Kay's already talked about now. One big problem with quantitative data, like the study that you just have looked at, is they're trying to boil a complex situation, like the impact of COVID on children and young people's physical activity levels, down to a single number that they think is simply easy to grasp and discuss. So within the paper that you just had a bit of time to look at, you can see that it is absolutely full of statistics that they have simply claimed as evidence. So it even says it in the title, evidence paper. So they've tried to really clearly communicate from themselves some really kind of sweeping statements on here. So it just launches straight into this document. At least a third of children have experienced an increase in mental health issues. 2/3 of primary school children report feeling lonely. Children have missed many things during lockdown. Obviously, some of them are probably fine, because you can probably guess that that's probably the trend. Things like this, though, amongst girls, 24% of those aged 11 to 14 and 50% of those aged 15 to 18 reported that COVID-19 and lockdowns had a negative impact of their mental health. So these are a bit more sort of some more kind of like, I don't know how to say it, kind of stereotypy statistics, when they've not talked in this about how many people that they've interviewed or where they've got this data from. One person might read this and assume that what they're saying is true for every single situation and every single child. So people love statistics, and in websites they love things like this. Oh, 38% more worried, 37% sadder, etc. Because they use these sort of bottom line scores to try and summarize what are really elaborate topics that previously would take pages and pages and pages to explain in qualitative data. So instead of looking at why particularly these statistics are the way they are, they've just tried to kind of sort of like stereotype all these children into one particular statistic. So it can be really difficult. On some levels, it can be useful because over time they might compare these statistics to other statistics that are less. So the exact same children, they might do it again in 2 months' time, but it doesn't say anywhere on the report where the children have come from. So the numbers basically can look good, but arguably be less credible and less trustworthy than qualitative data studies, where people have tried to find out the reasons why something has happened. In fact, most statistical research like this can be deemed as less credible than qualitative studies, and it is because things like ethnography or ethnographic studies, which are where they study someone over a long period of time or throughout an experience, is more actually deemed more scientific than doing statistics and statistical surveys like this. Another important thing to think about is that these factors are highly contextual, and they don't actually take into consideration other aspects that will influence human behaviour. For example, these children in this study might have felt like this, but we don't know where these children are. We don't know where they came from. We don't know where in the world they live. Well, we know that they're in England, but we don't know where in England that they live. So a problem with this is that whilst they've made these statements, there isn't many principles behind these studies, because so many issues are not explained in the study. And therefore, it can weaken the actual design project because there isn't, all you focus on is the numbers rather than the qualitative insights that might be given. Say they'd spoken to 20 girls from 20 odd boys from 20 different parts of the country, from 20 different backgrounds. We would learn so much more from that insight than we would from a kind of over statistical study like this. It doesn't often as well, like in studies like this, or what came out about the study is that it wasn't random like that. They'd actually approached, I think it was one school in one particular area and used a really simple approach, and that doesn't make good research, and it makes actually bogus findings that aren't representative. So it's really important as well that you think about making sure that statistics, cover correlations and themes too, but also odd things that would pop out. I would be really interested to know in what about the other children in this that didn't feel as stressed, what was different about their lives. So it's more about discovering more and more and doing things like that to try and make sure that the analysis isn't oversimplified. So to get good statistics like this, you need to make sure that the controls in the study are all fairly done. So it would be better to do a really tight study like this over a longer period of time with a really varied different subject group, so different age group or different parts of the country, like I said, or children from different backgrounds, because otherwise these statistics just generalize difficult topics and they try and make the problems, seem really simple. So the problem is as well is that it just doesn't offer the space to sort of approach those contextually complex topics too. So without harping on too much, in response to this massive study, not massive, sorry, this is very lengthy in sort of a publication, but the problem is it doesn't say who it was from, there's no context whatsoever. Okay, they say our work reaches as many as 20,000 schools. And I love the Youth Watch Trust, I've done lots of work for them, so I'm not slagging them off, but the problem is it's just not contextualized within this particular study. So to try and overcome that, myself and two colleagues, Dr. Tom Van Rossum and Paul Ogilvie, are undertaking our own study, which asks similar questions, but instead this is being sent to 3,000 children across Leeds. As a result of that, to be really open and really fair, we're saying right at the start of the study, this study undertaken by Leeds Beckett University explores the experiences of 2,000 children across the city of Leeds. Therefore, straight away, we're stating its limitations, that it's not representative of all different places in England, but just Leeds. But one good thing and one strength of our study is that we ask the students to put in our postcode. And then from that, there's a piece of software that automatically generates what the child's socioeconomic status of their home is like, or what that area is like, so that we can then do further insights based on the children. How do the results differ for children that are from higher levels of socioeconomic status and lower levels of socioeconomic status? So instead of grouping all children together as one big stereotypical umbrella term of children, we can make sure it's much more detailed and much more contextualized, and therefore much more accurate insights as a result of that. And we can look at different intersectional parts of their identity, like their socioeconomic status and their age, to try and get a more grounded response, and their ethnicity. So where we've put some questions that are similar to the study, so are your day-to-day activities limited because of a health problem or a disability, and get them to list their disability, things like that. So this was really short because we're just trying to get students to do it in PE, but there was the space to give longer answer texts. So we've got a bit of both here. We've got some quantitative stuff because we've got questions, but so I'm not saying any of that's not important, because it is, but then we've got the space for the children to write a longer answer text, such as thinking about the exercise you did before COVID-19, please list all the types of physical activities, sports you did. So there is lots and lots and lots of space on here for statistical stuff. But again, at the end of every single sort of section, we give space for a longer answer text. That means that the results are greater, more empirical and more rich data that we can analyse further. They use the different parts of a child's identity and not just grouping them under the generic heading of child. We look at their ethnicity, we look at their health problems or disabilities, and the study just generally hopefully you can see would provide much more insightful results as a result of being able to get a mixture of quantitative, but more in the context of this mini session, qualitative data. And therefore we can find out really for those children whose exercise dropped to 1 to 2 days per week, what happened before COVID, what changed. We'll be able to get much richer answers than we would from just doing one massive blanket survey that we send out to all children that does not bear any other part of the child's identity into consideration. So I hope this has given you a bit of an insight today into the difference between just doing a study that is just quantitative and the problems that can come with just publishing these kind of results without any context. And secondly, how you could do a better version of it yourself, should you wish to. Hope this has been helpful. Enjoy the rest of your lecture. Speak soon.